The background for this study is that patients with gynecologic cancers who receive chemotherapy experience an average of 10 to 13 co-occurring symptoms. And traditionally, when we think about symptom management, the tendency is to address each symptom individually. An emerging approach is to identify symptom clusters, which are groups of symptoms that co-occur and that may share an underlying mechanism. The idea is that if we can identify that underlying mechanism, we may be able to treat multiple symptoms at the same time. What was unique about our study is that we assessed symptom clusters in patients with gynecologic cancers at 3 time points over a cycle of chemotherapy: prior to chemotherapy administration, 1 week after chemotherapy administration, and 2 weeks after chemotherapy administration. We also identified symptom clusters according to 3 dimensions of the symptom experience: symptom severity, occurrence, and distress. What we found was that the symptoms comprising a hormonal symptom cluster, a respiratory symptom cluster, and a weight change symptom cluster were relatively stable across all 3 time points, regardless of whether we identified symptom clusters according to symptom severity, occurrence, or distress. Interestingly, gastrointestinal, psychological, and epithelial symptoms often clustered together. In addition, psychological and gastrointestinal symptom clusters were more apparent following chemotherapy administration. What this means is that interventions that target the underlying mechanisms of hormonal, respiratory, and weight change symptom clusters may reduce symptom burden throughout a cycle of chemotherapy. In addition, research to explain associations between gastrointestinal, psychological, and epithelial symptoms is warranted.